We've been talking a lot over the past 2 months with COVID about how we feel, what's happening, and what we're doing. And at the same time, we've been hearing a lot from our friends, me, other doctors, and my team here from their friends who are hygienists around the country about what's happening with them in their offices, their feelings and their thoughts, and how they're preparing to reopen. We have some friends that aren't going back to work because of it. There's a mix of emotions, and we felt the obligation and the position to communicate with everyone what we're going through, what our fears are, what our hopes are, what we're positive about, what we're cautious about, and what our thoughts are moving forward. So I guess, Amy, why don't you get started a little bit on kind of what your experience has been leading up to this, and maybe like why you became a hygienist and kind of what's happening right leading up to the point of through this COVID, your communications and what people are saying to you.
Mhm. Well, first off, why I became a hygienist. I always wanted to be a healthcare provider. And as I've been practicing hygiene for many years, it's changed a bit in that we were initially dealing with just the oral health of patients. And now, as we know, there's more of a connection to systemic health in terms of inflammatory issues such as heart disease, diabetes, autoimmune diseases. So I feel that I am dealing with the whole person's health and not just their oral health at this time. And I think that it's important to patients who are at high risk for inflammation to take care of themselves, get their teeth cleaned frequently, keep the bacterial load down so that they are healthy altogether. In terms of the COVID issue, of course, I was anxious when this first came about. The office closed, and I think as we all felt, we didn't know what was going to happen next.
Yeah.
Will we open? How will we open? What's going to happen? Will we have a job? And there's no question we've all been anxious,
Yeah.
certainly to different degrees. For myself, I am old enough to have worked through the AIDS epidemic. So I had been practicing without gloves and without a mask. And when I was told that you now have to put a mask and gloves on, I thought, how in the world am I going to be able to work this way? Well, lo and behold, I can't imagine this day working without either of them. And I think that going forward with the PPE that we are going to have, of course it's going to feel different. Of course I'm going to feel uncomfortable, probably claustrophobic under the new masks. But hopefully in due time, this will become our normal for as long as we have to wear it.
Yeah. What has been the sentiment with your friends and your colleagues in hygiene, not who we work with, of course, but your friends in the outside? What have been like, what are the things been saying to you, or what are their
So
thoughts?
I have been in touch with a few hygienists, and I have to say that the ones that I know well are not sure that they're going back into the profession.
Hmm.
And the
Yeah,
reason
me
is
too.
that they do not have any, little, if any, communication with the doctors in the office. They don't know what to expect when they come in. They have not been told what kind of PPE will be provided. And so the anxiety level is very high, as opposed to what we're going through. We've been communicating consistently through this period. I call Dr. Raimondi anytime I have a question. He's there immediately with an answer.
Hmm.
I ask him
Try to be.
anything that's on my mind, anything, and there's always an honest, transparent answer. So for me, I feel confident that we're going to be going back with the best protection and the safest way that any hygienist can go back to work.
Yeah. Well, thank you. Yeah, and I want to highlight that because we have a team of just under 20 people here, and there's a lot of questions, a lot of thoughts, and I want to encourage other people out there, hygienist employees, to reach out to their bosses when they have questions, and the bosses should be honest. Like, you don't have to know. Just like if a patient asks a question and you're not really sure, you could say to someone, "I don't know." It's better to say "I don't know" than to say something that you're not really sure about that you might think sounds better. Portia, so what made you go into hygiene? What does being a hygienist mean to you?
I mean, I've been a hygienist for 13 years. And years ago, I mean, when I was a child, I had a great hygienist. I had a great dentist. I always had positive experiences at the dental office. And I just looked into it and I found the profession to be interesting. I was very curious and I wanted to learn more. And the more I learned, the more I wanted to be a hygienist. So it was just the kind of thing where I looked into it and decided that's something that I wanted to do. I enjoy being a hygienist. I love connecting with patients. I think we have a great practice. So, I mean, that helps as well. I have a good relationship with patients, good relationship with the doctors I work with. And it's been a positive experience.
What are some of the things that your friends have been talking with you about, and what are some of the feelings you've had through this time of the past 2 months?
I think that a lot of the hygienists that I know have a lot of anxiety, or I would say more anxiety than I have. I agree with Amy, because they don't have communication with the doctors they work with, or they're having communication with the doctors they work with, and they're not implementing the PPE equipment that they feel they need in order to feel safe going back to work. I feel perfectly safe. I feel like you guys are providing isolite, surgical, air filtration. We're going to take temperatures before we come in. I just think that there's excellent things being implemented. So I feel 100% safe. And the reality is that we all became hygienists, and there was a degree of risk. We should treat every patient as if they have an infectious disease. We should treat everyone the same way. So now with the added equipment, I mean, I don't think we could be safer. I think I feel great about things right now.
Good. I'm glad. So Christy, you and I have been talking a lot about your groups that you're a part of, right?
Yes.
So maybe talk, before you get into that, also what being a hygienist means to you. I think it's really important, right, to focus on all of us together, like why you're here, right? Why we're here. For me, I've been looking at that a lot. Why am I here as a dentist who owns an office, who has a team? What does it mean to me? What is my goal? How do I get there? And that's a lot about what we've been focusing on as a team. So Chris, talk about real quick what it means to be a hygienist for you, and then some of the stuff we've been talking about with your groups that you're a part of.
So, like Portia, I don't know. I always like going to the dentist, and I always like getting my teeth cleaned. So that's
normal, yeah. No.
That's why really.
Positive hygiene experience.
When I was in high school, I assisted my dentist for a little bit just to see if I would like something like that. So I actually really enjoyed it and ended up going to school. But I just love the interaction with the patients, and if I can help them in any way, just making them healthier, not only dental health, but like Amy was saying, systemically, their overall health.
Emotional at times.
Yeah, I enjoy.
Oh yeah.
Yeah.
You want to know?
Therapist / hygienist. We should be together.
Yes, definitely therapist. I just enjoy making people healthier, and it makes me feel good. It makes the patients feel good. It makes our office feel good. So I just really enjoy that. And I have several licenses in different states. So Pennsylvania being where I initially was licensed, I have friends that actually are already back to work because they're in a perio office. So I haven't actually talked to them yet about how it is and how they're feeling about it and how it's going, but I do want to keep in touch with them. Other groups that I'm a part of, they're just very nervous. Their doctors aren't really communicating. They don't know what the changes are going to be whenever they come back. So that's what I've been hearing.
So I think the thing that everyone's saying here is communication, right? We have to have an open dialogue going back and forth between doctors and hygienists, between any two employees, between employers and employees. So what has it felt like? I guess what have we been doing? What does it feel like? The stuff we've been doing together on Zooms. What are a few of the things that I've done that's been most meaningful to you? And any order, anyone. What are the things that we did really well over this time period that you can encourage people to do if you're a doctor watching this, or if you're a hygienist? What could you do to help your doctor communicate better moving forward? Or the things we did well, do more of those things if you were to, say a few.
Amy kind of touched base on this a little bit about how you've been very transparent, and communication is key, obviously. But one thing that you've been doing that definitely helps is you've been checking in on us. You've been calling us saying, "Hey, how are you?"
I miss you guys.
Yeah.
Hello, Mickey.
So I think that just helps a lot because you're just trying to, see how we're doing and how we're managing, and nobody knows what they're doing.
No.
Nobody
And
knows.
also,
Right, exactly.
It's
and that also makes us feel that you sincerely care about us,
Right.
and as we know you do.
Yeah.
Not just as employees, but as people.
yeah.
Good.
I really respect the fact that you are communicating with us, as Amy and Christy said. But I also like that you and Dr. Stefani send us the information about the protective, the PPE equipment. Because it makes me feel cared for, and I feel more secure when I see exactly what it is we're going to be using when we go back to work. And also the phone calls, as Christy said, I think that helps, like being able to ask you questions, because this is your health, this is our health, as well as the health of our patients, and protecting us all. So I feel like you guys make us feel safe, and I think that's the main thing right now, as safe as you can.
100%. 100%.
Trying.
Yep.
I
Right,
also
so
know whatever you guys, when you guys do, get different equipment and stuff or talk about it and send us stuff, I truly know that you've researched it 100 times.
Right, that's exactly. Yeah,
Like,
when I looked at some,
above and
especially
beyond.
the isolite, I was like, I was
the
like,
one
oh my
they're over
goodness,
there.
why-
They're over here. Look, Stefani put them up here. Look.
That's awesome, because I said, why? I was thinking to myself, why weren't we using that before? Too, because I'm just like, all of this equipment is so great. Like, I feel like maybe you guys are going to set a dental standard, because these
Exactly.
things are. I mean, when I read about them, I'm like, oh my gosh, when you read about how much aerosols we put in the air before and how many things were happening that
right?
we just all kind of got accustomed to, and we do wear PPE. But when you read about how much it reduces, you know what I mean, the aerosols and things like that, I don't know. I mean, it just makes me feel like, oh, well, this is great. We're going to be fine going back to work. You know what I mean?
Right. So we're in New York City. We're in the hot zone, and many of us have had blood tests to see if we have antibodies. And I think one of our employees has antibodies, and she got it after we closed, and maybe not from our practice, but the rest of us are all negative. And so I feel like we were doing a lot of things really well, and the things we're doing to reopen right now, right? So we have an air filter here, and so this is a medical grade air filter with a UV light included in it. There are about 20 of them throughout the practice right now. There are isolites here. They're not installed yet. Someone's coming in to install them sometime this week, and we're getting the best PPE, right? It's like a drug deal. I feel like yesterday I picked PPE up. Like I rolled up. I texted someone. They came out. I gave them a check. They gave me boxes. It was like it's like a drug deal to get some proper masks.
Well, if anyone's going to find the proper mask, it's you. No question.
Very true.
Well,
yes.
It's just we had to call some favors in and devote a lot of time and energy into trying to get things. The other thing we're doing differently is we're changing how we're handling each other. Right? We're handling how we handle our time in the space together and how we handle patients. We have new forms to fill out electronically, the opportunity to people to pay contactless, and also make appointments virtually. So we're trying to do a lot of things to avoid people to having to be in the office and interaction with a person. We're also doing some telemedicine, so that's been really helpful. The things we're doing to communicate as a team, I think that's important because you guys all highlighted how we've been communicating. So we have two forms of communication. Well, three. One, we call each other, right? We call each other or text each other directly all the time. I mean, Amy and I, we talk a lot. I was telling a patient who I spoke to yesterday, how's Amy doing? I'm like, I just spoke to her an hour ago. We talk
Anytime I read
days.
something, I'm like, wait, did you see this?
we share podcasts and all dental stuff and non-dental stuff like we always have.
Yes.
We also have a group text with our entire office, every employee on it, every team member, so they can communicate any questions, concerns. And me and my partner, the co-founders of One Manhattan Dental, are constantly sharing things with everyone, what we're thinking, what we're doing, and trying to over communicate if there was an under or over. And the last thing we've been doing is a lot of what we're doing right now is Zoom. right? I don't know how many Zooms we've had, but it's a bunch. And
Mhm.
some of them are 20, 30 minutes, and some are an hour, and that we have, some are check-ins and some are housekeeping stuff. We've had some team building things, trying to work on building a better office together. And I think that kind of wraps all this stuff up we're doing. I don't feel it's so complicated. I don't feel like it's anything so
Yeah.
profound. But I think that if I were to try to send the message, and let's all try to think of something for people, if someone watches this, just like communicate, like you guys were saying, just be honest and communicate. The
Mhm.
doctors be honest, and
Mhm.
and hygienists be honest with the doctors they work for, and try to use this as an opportunity just to improve the relationship if it's not great, or strengthen it if it is good, and as an opportunity to
Mhm.
work together. As I tell all of my employees, I'm only your boss if you make me be. We are teammates and coworkers every other day,
Mhm.
right?
Absolutely.
Any,
Yeah.
yeah.
Good.
So if that's it, we wish everyone well. Reach out to us if you have any questions about what we're doing and what we think is helpful, or any tips about any of the stuff we spoke about. So wish you all well.
Okay. Thank you.
Thank
Yeah.
you.
Bye, guys. I'll see you soon.
Bye.
Bye.
Bye. Okay, that's it.